Hello everyone, this is Paul from OrthoValPal, and as promised I wanted to do a little video about some of the thoracic kyphosis reduction exercises that I like to use when people are rounded forward, the shoulders are forward, the head is craning into extension, causing some compression to the facets, and then the shoulders develop some impingement, because when you take those shoulders and bring them forward like this, you get an abutment between your greater tubercle and your acromion, and causes a mechanical pinching of the rotator cuff, bursa, and biceps tendons. So we want to try to get folks back here, open up the chest, and strengthen the scapular muscles. So what we're going to do is we're going to start off with one of my favorite exercises to get the pec major, which is going to be a corner stretch, and I'm going to ask Kendra to demonstrate. I typically have people stand in the corner. Elbows are going to be shoulder height. I don't like to go much higher than that. One foot in front of the other is very important, because if they have both feet out, their body weight is falling into the corner, and they're fighting that. They're fighting not to fall into the corner. So 1 foot in front of the corner and 1 foot in front of the other, and then you lean forward and get a nice stretch through the pec muscles. Now, a lot of people think that this is an adequate exercise to get into retraction, but really what this does is it stretches the pec major. I do 5 of these with a 30-second hold. But a better way to get the pec minor, which, Ken, I'm going to have you on the table here. A better way to get the pec minor is to take something like this, which is a little roll. We'll have the patient put that right in the center of the thoracic spine. And I'll take the thenar eminence of my hands, put it on her coracoid process where the pec minor attaches, and retract her this way. That way we get an isolated pec minor stretch, and I might do 3 or 4 of these and try to stretch the patient. And at home they could use something like this and just stay in this position and just let the shoulders fall back. All right. Now, if I want to improve, you'll stay right here. If I want to improve segmental mobility, I might take a roll like this and put it at her lower thoracic region and let her kind of fall over it. Okay, so she has more of a segmental extension of the thoracic spine. If we get the thoracic spine extending better, the neck will not fall into so much lordosis, and the shoulders will sit back a little bit better. Okay, and then I would have them do that for a couple minutes. I might have them come back up. I might move the roll back and then have them kind of fall over that so that the thoracic spine goes into relative extension. All right. The next thing I like to do would be a manual PA mobilization. So I'll have you right on your stomach. Again, a lot of these are passive. Okay. So I'll put some pressure right on the spinous process and try to gain some extension independently at each level. Okay. She's quite flexible, works really well. But people who are pretty tight in the thorax, these can really help improve their mobility and decrease neck pain. If they're super tight, they may need a bed that has a hole in it so the head can kind of sit in a neutral position. So now we're going to do a thumbs up exercise. So I really want to work the rhomboid musculature and mid-trapezius. So we're going to get you on the corner of the table this way. You never need a lot of weight with this one. Okay, little weights. Now she's going to rest the chin on the table, and you're going to make a T with your body. Okay, turning the thumbs up so we activate the rotator cuff, posterior cuff, and then we also activate the middle trapezius and rhomboid musculature. Love this exercise. See how easy this is to do at home, as long as you have a bed that doesn't have a footboard on it. If that's a T, you can also do the Ys, so you're going to go up a little bit higher. If the patient doesn't have any impingement in the shoulder, this will get the lower trapezius better. All right. Another exercise I like to do, I'm going to have you lying right down on your side facing me, Kendra, is side-lying external rotation. So not only do we activate the rotator cuff, but I like them to activate that scapula also. So she's going to go right from here to here. Doesn't require a lot of weight. Usually give them 3 sets of 10, 3 sets of 15, and they really feel this burn the rotator cuff. But I also have them work on that scapula a little bit. Okay. Next thing I'd like to demo would be a bird dog on a ball. This is another functional exercise. So I'm going to have you on your belly. And we're going to be going opposite arm, opposite leg. There you go, flexion of the shoulder, extension of the hip. And again, this promotes extension. You can even do those thumbs up exercises that we did on the table on the ball, so you can demonstrate that. Watch your hands over here. So thumbs out to the side. You're getting a little core stability while doing this also, and you can see how this really works on reducing that kyphosis. All right, you get to stand up. And the last thing I'll demo, and there's a million exercises you can do. You can do seated rows, lat pull downs to help with retraction. You can even take TheraBand like this and do those same exercises. If people can't get on their stomach or on a ball, you can take TheraBand like this and do the same thumbs out exercises just like that, and then bring it back together. We're trying to get the thumbs out there, trying to get the posterior cuff working as the scapular is retracting. So again, thanks for watching. These are some of the exercises that we do most commonly with patients to help improve or decrease that kyphosis that they have here and decrease this excessive cervical spine lordosis to get them from here to here and with better shoulder range of motion. So if you have any questions, make sure you connect with me at orthoevalpal.com. Please subscribe to our YouTube channel and hit the bell and you'll get notified every time I put up a new video. Thanks.